Good morning, sir. Good morning, everyone. I'm Majamila Asa Camille. So before we start to discuss the different types of the fracture, let's define first what is fracture. A fracture is a broken bone, the same as crack or break. A bone may be completely fractured or partially fractured in any number of ways, such as crosswise, lengthwise, or in multiple pieces. Fractures are commonly caused by fall from a height, car accidents, direct blow, repetitive forces, and pathology. The signs and the symptoms of a fracture. Number 1, swelling or tenderness, pain, numbness, bleeding, broken skin with bone, limitation, or unwillingness to move a limb.
Hello everyone, my name is Denise Ruby Unciano and today I will discuss the types of fractures. Closed fracture, also known as simple fracture. A closed fracture is one where the fracture hematoma does not communicate with the outside. The bone is broken but the skin is still intact or not damaged. The second one is open fracture, also known as compound fracture. This is one where the fracture hematoma communicates with the outside through an open wound. It is a fracture in which there is an open wound or break the skin near the site of the broken bone. Open fracture is more serious than closed fracture because once the skin is broken, infection in both the wound and the bone can happen. Stress fracture, also known as hairline fracture. It is a fracture occurring at a site in the bone subject to repeated minor stresses over a period of time. The fracture does not go all the way through the bone. It is just a very small crack in the bone. The next one is birth fracture. It is a fracture in the newborn babies due to injury during delivery process. It can be caused by the baby's bone being too fragile or by the baby's position in the womb.
Let us now proceed to the pathologic fracture. Pathologic, by the word pathologic, it is having to do with pathology or a disease. By the word fracture, fracture is a break in a bone. So all in all, a pathologic fracture is a break in a bone that is caused by an underlying disease. For example, osteoporosis, cancer. Cancer can be an abnormal cell growth on the bones, eventually weakening them and causing a break. Osteomalacia, a disease that softens the bones through the deficiency of vitamin D, thereby negatively impacting calcium absorption. Last example is the osteomyelitis, a bone infection. Let us now proceed to the impacted fracture. An impacted fracture, also called a buccal fracture, is a break where the ends are driven into each other. This is often seen with children's arm fractures. An impacted fracture occurs when the broken ends of the bone are jammed together by the force of the injury. Next is a traumatic fracture. A traumatic fracture occurs when significant or extreme force is applied to a bone. Examples includes broken bones caused by impacts from a fall or car accident and those caused by forceful overextension, such as a twisting injury that may cause an ankle fracture. Traumatic fractures may be non-displaced or displaced.
Good day everyone, I am Jamaica Faith Valdez and I'm here to discuss the fractures types of fracture. First, I will discuss this transverse fracture, a fracture in which the line is perpendicular to the long axis of the bone. So ito siya. Wait. Yan. Yan. Sa gitna yung hati. So, the primary cause of this fracture is traumas such as accidents or falls. So, in severe cases, there might be a need of surgery for bone repair In some individuals naman, they might only require the cast or splints for bone healing. Let's proceed to the next one. This oblique fracture. A fracture in which the line is at oblique angle to the long axis of the bone. Ito siya. Wait, let me focus. Ito, yan. This type of fracture can be caused by twisting or bending of the bone beyond its capability. This type of fracture tend to occur in long bones such as femur or tibia, and can cause displacement of bone fragments, causing timely treatment. So treatment naman may involve a surgery to realign the bone and stabilize it with pins, wires, or screws. In some cases, the affected area may be immobilized with a cast or brace to aid the healing process. The healing time of this fracture naman depends on the severity of the injury. The last one that I will be discussing is the spiral fracture. So the spiral fracture, a severe form of oblique fracture in which the plane rotates along the long axis of the bone. These fractures occur secondary to the rotational force. So ganito siya. Ganyan. Ito. Yan. So, malala siya. So, spiral fracture occurs due to the twisting force on the bone, such as falling and landing on an arm or leg while the foot or hand remains in place. This type of fracture can also result from sudden twisting force. Like in sports injuries and car accidents. This fracture can be challenging to treat and may require surgery to realign the bone and stabilize it until it can heal. Thank you.
So let us now proceed to longitudinal fractures. A fracture in which the number line runs nearly parallel to the long axis of the bone. A longitudinal fracture can be considered a long oblique fracture. What causes a longitudinal fracture? Longitudinal fractures comprise 80% of all temporal bone. They are frequently caused by a lateral force over the mastoid or temporal squama, usually produced by a temporal or parietal blows. So what is the treatment for the longitudinal fracture? Some minor long bone fractures may heal with conservative treatment such as casting or physical therapy. Most long bone fractures require surgery to stabilize injured bones while they mend. So let's proceed to comminuted fractures. Comminuted fractures, the bone is broken into two fragments. So what is the most common cause of comminuted fracture? Most commonly, comminuted fractures occur as a result of trauma. Bone requires a lot of force to break in multiple places. Therefore, trauma that results in a comminuted fracture is usually severe, as occurs in a car accident or falls from a great height. You will need a surgery to repair your bone, and recovery can take a year or longer. So how are comminuted fracture treated? Someone with a comminuted fracture will probably need surgery. Then they will need to wear a splint or cast for a while to keep the bone from moving while it heals. So the last one is stellate fracture. Stellate fracture occur in the flat bones of the skull and in the patella, where the fracture lines run in various directions from one point. This complex stellate skull fracture was caused by a direct blow to the head. For the most common of cause, such as being hit with an object, motor vehicle accident, or the most skull fractures treatment consists of close observation in the hospital and medication to relieve pain during the healing process. However, some skull fracture requires surgery.
So let us now discuss the type of fractures. First, we have the plastic fracture. Plastic fracture refers to the deformation of a bone without fracture of its cortices that persists once the deforming force has been removed. It is not a common condition but is seen more frequently in children than in adults. Avulsion fracture. Avulsion fractures usually happen to young athletes. You might be sprinting, hitting, sliding, or doing other sports activities that involve quick movements and sudden changes in direction. A piece of bone attached to a ligament or tendon breaks away from the main part of the bone. It might take up to 12 weeks for you to fully heal. Let's go now to green stick fracture. Green stick fracture is a partial thickness fracture where only the cortex and periosteum are interrupted on one side of the bone but remain uninterrupted on the other. They occur most often in long bones including the fibula, tibia, ulna, radius, humerus, and clavicle. Simple fracture, little or no bone displacement. Fracture ruptures the skin and bone protrudes. Occurs mostly in children whose bones have not calcified or hardened, that is green stick. Transverse fracture, crack perpendicular to long axis of the bone. The displacement may occur. Oblique fracture is a diagonal crack across the long axis of the bone. Spiral fracture is a diagonal crack involving a twisting of the bone about the longitudinal axis. Comminuted fracture. Crushing fracture, more common in elderly. Impacted fracture, one end of bone is driven up into the other. The press fracture, broken bone is pressed inward. It is also called the skull fracture. Avulsion fracture is a fragment of bone is pulled away by tendon.
Position. Patient position in supine with the pelvic stabilized, again well-padded vertical perineal post traction of operative leg, achieved either by boot-shaped cut or device with straining strap. An affected leg may be rested on well-padded, elevated leg holder, common position for ORIF or hip or closed femoral kneeling. Healing. The fracture hematoma initiate the healing response within 48 hours. Chemotactic signaling mechanism attract the inflammatory cell necessary to promote the healing process, and within 7 to 14 days, granulation tissue is formed between the fragments, leading to the vascularization of the hematoma. On radiograph, there may be increased lucency of the fracture during the stage due to the resorption.
Hello sir, I am Jenny Claire Ganal and I will discuss about the non-union and malunion. Non-union, the healing stopped before union occurred. A condition where the healing process of a bone fracture stops before complete union or healing of the bone occurs. It is a more severe and challenging situation than delayed union. Non-union may require more extensive medical intervention such as surgery or the use of bone grafts to stimulate the healing process and achieve bone union. Example of non-union is a fracture that fails to heal properly even after an extended period of time. For instance, let's say an individual fractures their tibia bone in a car accident. Despite receiving proper medical treatment, immobilization, and sufficient time for healing, the fractured bone does not mend together and remains separated. This condition, known as non-union fracture, can occur due to various factors including excessive movement of the fractured bone, infection, poor blood supply, or inadequate immobilization. Malunion, the fracture healed in an acceptable position, is a condition in which a fractured bone has healed in an acceptable or improper position. This can result in deformities, functional limitations, and discomfort. Treatment for malunion may involve orthopedic procedures to correct the alignment of the bone, such as osteotomy or bone cutting and realignment. One example of malunion fracture is a fractured femur that heals in a slightly misaligned position. This can occur if the fracture is not properly reduced and stabilized during the healing process. As a result, the bones may heal in a position that is not anatomically correct, leading to issues such as leg length discrepancy, altered joint mechanics, and functional limitations.
Hello everyone and good day. I am Ariane Villian and today I will discuss to you the fracture management and healing. But first, let's discuss the principles of management. Principles of management in this context refers to the principles followed in managing injuries or fractures. In this principles management, we have three aims. Number one, we have the safe life, ensuring the patient's overall safety and well-being. Second, we have the save the limb, prioritizing efforts to save the injured limb and prevent amputation if possible. And last, save the function, focusing on preserving the functionality and mobility of the injured limb. So here guys, we have these steps to achieve these aims. So first we have the number one, efficient first aid, providing immediate first aid and measures to relieve pain and prevent complications. Number two, safe transport, ensuring safe transportation of the injured person to a healthcare facility. Special care is taken in case of spinal injuries, fractures of the lower limbs, ribs, and etc. Immobilization of fractured limb is important to minimize further damage. Number three, we have the assessment of the patient's condition, evaluating the patient for signs of shock or other associated injuries. Number four, assessment of the injured limb. Assessing the local condition of the injured limb to identify any complications such as vascular injury, nerve involvement, or damage to neighboring joints. Number five, we have the resuscitation. Resuscitation. Dito po sa resuscitation, if kailangan lang po. So, providing necessary resuscitation measures to stabilize the patient's condition. Number six, radiography, performing X-ray imaging of the injured part. This includes X-rays before applying a plaster cast to determine the site and degree of displacement. Post-reduction films to ensure proper alignment, follow-up films to assess healing progress, and last, pre-removal films to confirm complete healing. We have the last step, guys. Number 7, reduction of the fracture. Correcting the displacement of fractured fragments. This can be done through close manipulation. Close manipulation is the manually realigning the fracture without surgery. Or open reduction, this means surgical intervention to align the fracture fragments. So guys, these principles and steps are form as a systematic approach to managing injuries and fractures with the ultimate goal of ensuring the patient's safety, preserving the limb and maintaining its functions. Thank you.
Other terms used in describing fracture, we have the plastic. Bowing fracture in children without disruption of the cortex. Aplastic or bending deformities. Children's bones are a bit more flexible than adults, so they can develop some bowing or curvature to a bone without an obvious fracture line. These are still treated like a fracture to help the bone reset correctly. Next, we have distraction. It is a separation of fragments that have been pulled apart. A distracted fracture fragments are separated by a gap.
Good day everyone. I'm Shamantha Nicole Taguba and I'm going to discuss the depressed fracture. Depressed fracture, skull fracture, is a comminuted fracture in which the broken bones displace inward due to a blunt head trauma, such as a broken outer table is located below the normal anatomic position of the inner table. Although the skull is tall and provides excellent protection to our brain, a sever below or trauma can cause fracture. Skull fracture are influenced by a number of factors including thickness of bone, mineralization of bones, and the force along with its mechanism of impact.
So now guys, let's proceed to the fracture healing. Fracture healing is a complex process that occurs in several phases. So here we have these several three phases. First, we have the inflammatory phase, which means this phase begins immediately after a bone fracture. So it involves two stages. First, hematoma formation. When a bone breaks, blood vessels are damaged, leading to bleeding at the fracture site. The blood forms a clot known as hematoma, which helps stabilize the fracture and serves as a scaffold for healing. Letter B, we have the granulation tissue stage. This is the immune cells and fibroblasts migrate to the fracture site. The immune cells remove debris and bacteria, while fibroblasts produce a fibrin matrix, forming granulation tissue. This tissue helps promote blood vessel growth, bringing essential nutrients and oxygen to the site. And now let's proceed to the second phase. Re- this is the reparative phase. During this phase, the body begins to repair and bridge the fracture gap. It here also consists of two stages. First, the fibrocartilaginous callus stage. Specialized cells called chondrocytes produce a soft callus made of fibrocartilage. This callus forms between the fractured bone ends, providing initial stability and support. Letter B, bony callus stage. The fibrocartilaginous callus is gradually replaced by a bony callus. Osteoblasts, which are bone-forming cells, deposit minerals such as calcium and phosphorus onto the callus. This process leads to the formation of woven bone, which helps bridge the fracture gap and provides further stability. And lastly, we have the remodeling phase. In the final phase, the newly formed bone undergoes remodeling to restore its original strength and structure. This phase involves the following: osteoclast, specialized cells that break down bone tissue, remove excess or unnecessary bone material from the fracture site. Simultaneously, osteoblasts continue to deposit new bone tissue. This dynamic process of bone resorption and deposition reshapes the bone, replacing the initially formed woven bone with more compact and organized bone tissue. The remodeling phase can take months or even even years to complete, depending on the factors such as the type and location of the fracture, the individual's age, and overall health. Overall, the fracture healing process is a highly regulated and intricate series of events. It requires good blood supply, appropriate immobilization, and adequate nutrition to ensure successful and optimal healing of the fractured bone. That's all. Thank you po.